Thank you for watching the examination of hip and groin. Um, Obviously, with any joint examination, the history is important um, about the nature of the injury and the mechanism of the injury, so that it will help us to focus on that particular part of the injured muscle or the ligaments. Let's have an examination of the hip with the inspection first. You can take the top off, please. Thank you. And face the wall. Can you come a little bit that way? Thank you. Look for the level of the pelvis. See if there is any pelvic tilt on the level of the shoulder, or if there is any paraspinal spasm in the curvature of the spine, if there is any scoliosis. And have a little feel if there is any tenderness of the sacroiliac joint. Thank you. If you can have a few steps up and down in the room, please. Look for if there is any antalgic gait or Trendelenburg gait. Thank you. And if you can turn facing towards me, please. This way. And can you stand on your tiptoes, please? Thank you. And on your heels. Thank you. This is just a brief neurological test. And can you squat and stand up? Yep. Thank you. Now if you can face towards me, this is the Trendelenburg test. If you stand up on your one leg, yes. Thank you. On the other leg. Thank you. This is to look for if there is any pelvic tilt or pelvic sag. So if there is any abductor mechanism is weak, so the sound side sags. Thank you. If you can lean back. Stand on one leg, please. If you suspect any sacroiliac joint, ask the patient to stand on the normal, on the affected side, and lean a little bit backwards and see if there is any pain in the sacroiliac joint, which is a Stonk test. Thank you. Now if you can lie on your back, please. Thank you. We shall now feel for the structures in and around the hip joint. To start with the medial side. Obviously we compare on both sides for the examination, but for the examination, for the current examination purpose, we'll concentrate on the right side. So start with the feel in the pubic tubercle, pubic symphysis, inguinal ligament, gracilis tendon, can you give me a cough, please? Okay, check for if there is any hernia, and anterior inferior iliac spine, anterior superior iliac spine, iliac crest. Okay, can you roll over to the side, please? Right, just right here. Okay. Feel for the iliac crest, again sacroiliac joint, ischial tuberosity, and the greater trochanter, and the iliotibial band. Yeah, thank you. Now we can look for if there is any flexion, contraction at the hamstrings and also the hip. So to look at the hamstring contraction, relax this one. Thank you. Flex the knee and feel for the hamstring. Usually the patient will be able to extend the knee beyond 140 degrees, but if there is any restriction below 140 degrees, then that's some evidence of hamstring contraction. Thank you. Now we shall look for the flexion contraction of the hip, which is by ask the patient, which is by the Thomas test. Ask the patient to bend both the thighs, and if you can raise the height, please. Yeah, back your head down. Thank you. And now we'll extend the whole together, and we'll try for the normal side first. Now extend to see if there is any flexion contraction. In this case, there's no flexion contraction, as when it can straighten the leg completely. And we'll repeat on the other side. Hold on. Yeah. Thank you. Okay. Now you can relax. So there is no evidence of flexion contraction of the hip. I will ask the patient to do some active movements, which is the flexion, extension, abduction, adduction, and internal and external rotation. I'll ask the patient to start with the flexion first. We'll try with the right hip. Thank you. Can you bend this as far as you can go? Thank you. Yeah, next. And can you, with the knee straight, can you pull your leg out? Thank you. And this abduction and adduction. Cross your legs, please. Thank you. And can you roll over, please, on your tummy? And with your knee straight, lift your leg up. Thank you. Yeah. Thank you. There's no obvious restriction of the movements. You can roll back again, please. Thank you. With the knees together, with the ankles together, bend the knees, please. And let the knees go floppy. Floppy out. Let go. Good. Okay, yeah. And together, please. Thank you. Now we shall do the active movements and the passive movements if there is any restriction of active movements. So we can particularly for the internal and external rotation. So that's the external rotation of the hip and the internal rotation. Okay, there's no obvious restriction or any pain. I'll ask the patients now to we can also check for the internal and external rotation by asking the patient to lie prone. Can you lie on your tummy, please? With the legs, with the knees bent, then we can ask the patient to do the internal and external rotation. Thank you. Thank you. We shall now look for the power, the muscle power. If you can keep your raise your leg up. That's good. And press me down. Good. And push me out. Good. And pull me in. Good. And now bend your knee, please. And again, push me out. Okay.
Right.
Yeah, this way. Good. And pull me in. Good. Thank you. So the power is normal. We shall look for a more specific if there is any stress fractures of the hip by doing the percussion test, which is by do some tapping on the heel like that. Or you can do where the pressure is transmitted through the neck of the femur. Or you can do that by tapping at the knee as well, or the greater trochanter. Okay, thank you. And also now we'll look for any snap at the either the iliopsoas the labrum or the iliotibial band, depending on where if the patient is complaining of any clicking sensation. Yeah, so it is flexion, internal rotation, and then extension to see if there is any click or the snap that either you can hear or feel, or the patient can feel. And that's for the labrum. Also you can look for if there is any clunk feeling to see if there is any labral tap. Okay, thank you. Now we shall look for the piriformis syndrome, which is ask the patient to go to the side. Thank you. Feel for any pain or negritus medius, and see if there is just around the piriformis area, and ask the patient to bend the leg, so the hip flexed, and see if there is any pain at the piriformis area. And also you can do the sacroiliac joint percussion test by tapping on the sacral joint, or by pressing on the iliac crest to put any stress on the sacroiliac joint. There's another test for the sacroiliac joint, which is the Faber test, which is flexion, abduction, and external rotation. Thank you. So do the flexion, abduction, and external rotation, and also putting if there is ipsilateral hip pain, the patient will complain of pain in the joint that's been externally rotated. And if you put pressure on the opposite pelvis, and which is you're stressing the sacroiliac joint on the other side, if the patient complains of pain in the posterior hip, then it is suggestive of sacroiliac joint pathology. Thank you. One more test is the Ober's test, which is for the iliotibial band pain. If you can turn around this way. Feel for the hip, feel for the gratitrochanter, and just for the iliotibial band, and ask the patient to let the leg drop down. If the pain is reproduced, it is suggestive of the iliotibial band pain, and if the pain is better by easing that stretch, it is suggestive of the iliotibial band pain. Thank you. And if you can roll back, please. Now, just to complete the examination, check for the femoral pulse and the dorsalis pedis pulses. And the posterior tibial. And can you feel me touching here?
Yeah.
On both sides are equal?
Yeah.
Yeah. Okay, thank you. So that completes the examination of the hip and groin. Okay, thank you.